Yes, good morning, Dr. Primm. Thank you so much for letting us speak to you this morning, and we're now looking forward to hearing about some of your new and exciting projects. So please, do get started.
I'm very excited about the work of the Office of Minority and National Affairs, some of our current projects that I'd like to highlight for you. First of all, we have an African American mental health video coming out. And this is really the second in a series. We've done previously a video or DVD called Mental Health, a Guide for Latinos and Their Families. That's been a very popular item. It's for public education to raise awareness about mental illness and reduce stigma. And in the same vein, we're doing this for the African American community. We're very excited because this DVD includes Dr. David Satcher, the former Surgeon General, and he has a special interest in mental health and issued a report on mental health as well as a report on mental health in the context of diverse cultures during his tenure as Surgeon General. And so he's helping to kick off the DVD. And there are a number of individuals who have experienced mental illness themselves, who are African American, and who speak very candidly about their experiences in the DVD. We are anticipating a release of the DVD in early 2012, and we intend to send out copies all over. We've done the same with the Latino mental health video, and we're excited that we'll be able to make an impact in terms of people's understanding of mental illness and their willingness for treatment. Really, this is all about reducing stigma and is very much a part of the goals and objectives of the Office of Minority and National Affairs. Another project that we are working on is called the Recovery to Practice project. Some people may not be familiar with the concept of recovery from a mental health standpoint. Perhaps they're more familiar with recovery from the substance use disorder standpoint. But there has been a movement, if you will, in mental health to focus on recovery that is focusing on hope for the individual with mental illness, on empowerment where an individual with mental illness can feel free to speak up in their interactions with their psychiatrist and have a sense of a future. In the past, some people thought of mental illness as almost like a death sentence, as something that they would have to endure without any relief for the rest of their lives. But we know that with treatment that people can do quite well and go on to live a fulfilling life in the community. So this project seeks to educate psychiatrists about recovery and about recovery-oriented care and how to practice it. And so we're essentially developing a curriculum, and we're doing this in partnership with the American Association of Community Psychiatrists. The AACP, as it is also known, has a number of members who've been leaders in the American Psychiatric Association and very much a part of the Institute for Psychiatric Services. And I'm delighted to be working very closely with my colleagues who are leaders in that organization to develop this curriculum. We are planning to focus on a range of psychiatrists, of course psychiatrists in training, in residency training, medical students, fellows, early career psychiatrists, and those psychiatrists who work in the public sector, because we feel that those psychiatrists are the ones who could really benefit from this information on how to look at their care a little differently, really focusing on the experience of the individual with mental illness and making sure that the care is very welcoming, is very engaging, really enlists the person with mental illnesses active participation in terms of decision making about their care, and really engenders a sense of hope, a sense of a future, that people can actually realize their goals and achieve their dreams. And that's what we should be doing, working in partnership with people with mental illness to have those kinds of outcomes. So we've taken quite a bit of time to gather information from the field, hearing from people what they think about recovery, what do they know about it, what are some of the barriers to actually practicing in a recovery-oriented way, what are some of the facilitators. And we have done this in partnership with people who are in recovery, people who have mental illnesses, because of course that saying nothing about us without us certainly applies here, where we really want to incorporate the perspective of the person with mental illness in this curriculum. So we're trying some innovative approaches. We are going to have kind of a multimedia approach to the curriculum materials. We're using video tapes of kind of reenactment of clinical interactions to help kind of teach and model what the recovery-oriented approach really is. And we're also utilizing a panel of psychiatrists, of persons in recovery, family members, and others to sort of in a discussion format to illustrate the various aspects of recovery. We think that this will be a dynamic way to transmit to the audience the whole concept of recovery. We plan to have an online version as well as a face-to-face version for training psychiatrists about this, and it's going to have continuing medical education credits. In fact, we're working very closely with the APA Division of Education, Dr. Deborah Hales and her staff, in bringing this project to fruition. It's supported by SAMHSA, and we anticipate completing this project in the next 2 years. So this will be a wonderful product that the American Psychiatric Association and the American Association of Community Psychiatrists can be quite proud of developing, and we're hoping that it will enlighten psychiatrists across the country working in a variety of settings.
Oh, these are wonderful things, and I thank you so much for your time this morning.